Yeah, we invite Dr. Jyoti Goyal. She will be presenting her paper on a sling to prevent intraocular lens swing, a prospective interventional study interim analysis. Dr. Jyoti Goyal.
Okay, a very good afternoon, everyone. So before I begin with my presentation, I want to address all the residents and postgraduates who are sitting over here who, just like me, have just begun their journey towards the cataract surgery. Guys, this presentation is dedicated to you all. So these are the abbreviations that I've used in my presentation. So let me introduce you all to my topic briefly. Every year, around 20 million cataract surgeries are performed, out of which around 2 to 3,000 surgeries are complicated by either posterior capsular rent or zonular dialysis. And around 115 patients with potential vision are left with suboptimal vision because of no IOL. So why am I talking all these big numbers is because in my study, I have addressed these complications and worked upon a solution, a technique which is simple, stable, for well-centered placement of IOL, and it also prevents one of the most dreaded complication of any cataract surgeon, that is the IOL drop. So this is a video where I will be showing how this technique is used. So this is a case which is complicated by intraoperatively posterior capsular rent, and now we are going to place the IOL in the sulcus using this suture sling technique. So step 1 is to pass the 10-0 nylon suture through the dialing hole of the optic. After that, we will be directing the leading haptic into the sulcus as shown in the video. This is followed by dialing of the trailing haptic with the AIOC2023 hook dialer, and we have to make sure that we dial it horizontally into the sulcus. After that, we perform a thorough anterior vitrectomy, and we have to make sure that the entire vitreous is cleared from the AC. We washed all the viscoelastics from the AC, and after ensuring the stability of the IOL, we cut one end of the suture and pull the other end of the suture gently. So we are planning to use this technique in 58 eyes in our hospital, which is a tertiary eye care institute, and this is an interim analysis of this prospective interventional study. So in my study, I have included the patient which have intraoperatively PC rent or where there is a zonular dialysis of less than 2 quadrants. And patients where there is a large PC rent or inadequate ciliary sulcus support, or cases where there is a zonular dialysis of more than 2 quadrants, or patients where lens material has already dropped into the posterior segment are excluded from this study. So post-operatively, these patients are being followed up at day 1 week, 6 weeks, and 3 months for visual acuity assessment and detailed anterior and posterior segment assessment. And in addition, at 6-week follow-up, we are looking for IOL centration in slit lamp photography and IOL tilt via ultrasound biomicroscopy. So on slit lamp photography, we calculate the ratio of limbus to the IOL optic edge, and if this ratio is between 0.5 to 1.5, it is said to be centered. On ultrasound biomicroscopy, we are calculating the tilt of the IOL. So we draw a line passing through the iris plane and another line that is passing through the optic of the IOL, and the angle between them is said to be, if it's more than 15 degrees, the tilt is said to be significant. So this is our data collection sheet, and till now we have enrolled 48 patients in our study, and this is interim analysis of 10 patients. So on the analysis of 10 patients, these are my results. All the IOLs were stable and centered without any significant tilt. There was no intraoperative or post-operative IOL drop in these 10 patients. The logMAR visual acuity improved significantly at 1st and 6-week follow-up. So finally, I would like to conclude with this following conclusions, that this technique is very useful in trainee or novice surgeons, especially when they have many maneuvers to do because of there is a more chance of haptic slippage in these novice surgeons. This sling, it acts as a rescue anchor and it is a very simple and effective technique which increase the window of safety for all the novice surgeons. And there is a minimal, it requires very minimal surgical time and expertise, and this is very useful especially in resource limited settings, places where there is no vitreoretinal backup. This technique can be a saving technique. Thank you.
Thank you, Doctor. But were the lenses PMMA?
Yes.
Yeah.
Non-foldable PMMA
Non-foldable
lenses.
PMMA lenses.
Yes.
So you're not putting any stitch and something, just you're
No,
pulling
no.
it out after you've
Yes.
placed it in the sulcus.
Yes, yes,
So
yes.
this is just another safety measure
Right.
for the novice, as you said. We
Right,
understand.
Just for our information, how many patients have you had to resort to this technique?
We have used this technique in 48 patients till now. We are planning to use it in 58 patients. In 48 patients, we have not experienced any major complication related to the sling. There was this one case where there was entanglement of the sling, but then it was that patient was left aphakic, because we also use the sling to, we have this guide to explant the IOL using, because there is this anchor in our hand where we can direct the IOL, we can center it basically, because we have the sling in our hand. There is this anchor we have, so that has helped a lot, especially for the trainee surgeons who have just begun. 10-0 nylon suture. Thank you so much, sir.